In our summit rounds this week, we talked about our ERAS protocol. So what is ERAS, what does it stand for, and what does it mean? ERAS, or ERAS, stands for Enhanced Recovery After Surgery. The history goes back several years. In gastrointestinal surgery, people started to look at ways to improve outcomes by focusing not just on one aspect of the surgery, but on every opportunity that there would be potentially for benefit. So maybe it's preoperative nutrition, or the type of antibiotic used, or a perioperative pain protocol, ways to prevent DVT and PE, and the list goes on and on. In my opinion, ERAS protocols are much more than an order set. They are a culture. They require the input and support of everybody within the medical system that touches or contacts that patient through the surgical process. ERAS protocols are not stagnant either. They should be constantly looked at, developed, discussed, and are one of the great ways that we can improve surgical outcomes. Our weekly summit rounds and our yearly conferences and our ongoing discussions with providers in our community and amongst ourselves is really the ongoing development of our ERAS protocols, and an extension of that would be our general way of interacting with our patients and helping them to get their lives back and to live the healthiest lives possible. I believe that as providers within the community group together, put in their collective wisdom, communicate and talk and get creative even, and then combined with that process of incremental improvement, the patients themselves are also looking for ways to make small and incremental improvements in their health. That's the environment that we get the best outcomes. And I hope that in our community we are supportive of that environment. And I also hope patients feel empowered to join in this process and to look at every aspect of their lives where they could possibly make small incremental differences. And collectively, patients can achieve, I think, the best outcomes.